I'm Abby. I'm your nurse practitioner, and I will be doing an assessment on you, doing a cardiac and vascular assessment. I'll be first doing an assessment, inspection, palpation, auscultation, and then I'll let you know about the results afterwards.
Okay.
Okay, so first I would have him in a gown, appropriately gowned. I'm gonna have the bed at about 30 to 20 to 30 degrees. I'm assessing the neck, looking for any evidence of jugular vein distension, and I do not see any here, this gentleman. Looking at the carotid, and looks like that's normal. And then I am going to look at the apex of the heart, which is in the fifth intercostal space here. Note if there's any unusual bounding, and there's not. There's no noticeable bounding, which is a normal finding. Next, I'm going to palpate the carotid, checking for the grade of the carotid on both sides, and that is at a 2+. The other side is also a 2+, and that's normal. Next, I'm going to palpate the apex of the heart. That's the point of maximal impulse. Again, a fifth intercostal space. And that is at a 2+, which is also normal. Next, I'm going to, you're doing well so far. So next, I'm going to auscultate. I'm going to use the bell. I don't have a cardiac one, so I have to use the bells on this side, diaphragms on this side. I'm going to do the bell first, and I'm going to listen at the carotid to note any breweries in that area. So go ahead and hold your breath. Good, and go ahead and release that. And then hold your breath one more time. Good. So there's no evidence of bruits in the carotid. So next, I'm going to do the 5 points of the heart, using the diaphragm first, and then switch over and do the bell afterward. So first, I am doing the aortic at the second intercostal space, the pulmonic, the herbs point. The tricuspid, and then again the mitral, and then I do it again with the bell. So second intercostal space on the right side, listening to the aortic. Second intercostal space on the left side, listening to the pulmonic. Third intercostal space, looking at the herbs, or listening to the herbs. And fourth intercostal space, listening to the tricuspid. And the fifth intercostal space, listening to the mitral and apex. So there's S1, S2, as there should be. There's no evidence of S3 or S4. If there was S3, that would be indicative of fluid overload, and that's not ideal, of course. And then S4, that would be a left ventricle hypertrophy, which is evidence of untreated heart condition, congestive heart condition. So next, I am going to I'm going to assess the vasculature, and so for that, I am going to sorry, my hands are sweaty. I am going to palpate the radio pulse, and that's a 2+. regular rate rhythm. While I'm doing that, I'm going to assess for cap refill. It should be less than 3 seconds, and it is. And I'm also going to assess for upper edema, so I'm going to push down on that lower, on that forearm, let go, and make sure that it rebounds normally, and it does. And then I'm going to now check the femoral artery, so that's okay?
Yep.
So I'm going in here. And I feel it slightly, it's about a 1+ because it's hard to feel, but it's there. Next, I'm going to go down to the feet. Is it okay? Okay, cool. And I'm going to check the posterior tibialis, which is right behind the, I feel it, the lateral malleolus. That's about a 2+. And then I'm going to check the dorsalis pedis, top of the foot, and that's a 2+ as well. That's great. I'm also going to check cap refill on the toes, and the foot. It should be less than 3 seconds, and it is. I'm also going to check for edema on the lower legs. So I'm going to press down and then release, making sure it rebounds as it should be and normal. If I need to do an ankle brachial index, I would, that's evidence, that would be to confirm if there's any peripheral vascular disease. And some of the signs of that are cold lower limbs, evidence of caudation, and that would be based on what the patient says. If they say that when they walk they feel some pain, but when they rest it goes away. It would be very shiny and hairless, and there could be some lesions or unhealed wounds in the area. But none of that's evidence. He's looking good. Thank you.